All right, you guys, today we're going to be talking about some of the problems you might be facing if you have muscular dysfunction in the pelvic floor. So men, I'm talking to you. Hopefully you caught our other video. I don't want you feeling stuck, bouncing around doctor to doctor, testing to testing, meanwhile with pain and issues that are interfering from a healthy lifestyle. Pelvic floor issues don't just come from aging or things that you feel like you have no control over. I'm seeing younger and younger clients, and I just want you to understand your own anatomy so that you can help yourself a lot sooner. So some of the issues you might be facing, regardless of age, could be erectile dysfunction, could be issues with peeing or pooping, even including IBS, even issues related to tension, anxiety, things like that, gut health. The pelvic floor and digestive system are very closely linked and have a very significant impact on each other for functioning well. So any of those issues, of course, sexual things like erectile dysfunction, premature ejaculation, difficulty sustaining an erection, none of those are regular, normal things that you should be dealing with. But again, you don't necessarily need medications or a surgery. Obviously, hemorrhoids can play a role as well, and that's why we're talking about some of the bowel dysfunction and how those play into each other. But I want to help you understand your anatomy because I don't want to keep hearing from my clients that they've been seeing doctors for years and no one has answers, and everyone keeps, especially the younger guys, they're having testicular pain and being told they must have an STD they haven't found or some sort of infection, and then you get put on multiple rounds of antibiotics. And I think not only is that traumatic to your gut health and your body, it's traumatic and insulting to a lot of my clients have been in monogamous relationships, and yet providers are insisting they must have STDs or some other things going on. And so a lot of times you have muscles underneath your glutes that can contribute even to just more basic hip and back pain that can be affecting your running, that your workouts, your weightlifting, suddenly your squat's not feeling the same, your deadlift's feeling off, you're trying to get back into sports and things are not going well, you're having pain with sitting. When there's perineal tightness, which is just that band behind the testicles before the anus, that often feels like you're sitting on a golf ball. And so there's lots of things you can do to treat your muscles, just like you would treat a shoulder injury or a quad tear or something like that. But we're not taught we have muscle there. So those might be some of the problems you're facing. Want to get into a little bit more solutions. It starts with awareness. Obviously, you can't help or treat muscles there that you don't even know exist. So again, I didn't want to get into all the boring names. You have two layers. There's some muscles that are along the shaft of the penis that go across the base of that perineum, and inside there's a second deeper layer of muscles that form kind of a hammock from the tailbone down to the sit bones and then around in the front to the pubic bone. And so of course those go between our hips, but we don't really think about our sit bones or muscles inside our hip sockets. And so that's how it can sometimes contribute to tailbone, back pain, and hip pain. Pliability is king. Just like for any athletic sports or function, you want to be strong, but also for those tissues to be mobile. Same thing applies to the pelvic floor. Just like your right shoulder could be tighter than your left, the right side of the pelvic floor can be tighter than the left. Especially in a lot of asymmetric sports, sometimes golf. We often see more pelvic floor issues prevalent in weightlifters, cyclists, anything involving horses, rodeo, competing, motocross. Obviously, there's more direct impact and use of the pelvic floor muscles with some of those sports. So just know that those are some common things that you might be dealing with, but that you can treat it like a basic muscle injury. Pelvic floor therapists are trained to do manual therapy on those muscles and to help you know what's tight, what's weak, and resolve any of those asymmetries. So there are solutions out there that hopefully do not need to involve any kind of needles, surgeries, medications, and I just want to help get this information out there so that you're not stuck scrolling Reddit until the wee hours of the night like so many of my clients say they are, or bouncing around from specialist to specialist, being dismissed, being misdiagnosed, having pieces of things missed when it might just be muscular function. So we're here to help.